And whilst I enjoyed treating patients with a scalpel to restore functional health, what really intrigued me about the science of anatomy really led me into revitalization and rejuvenation techniques. What lies beyond the scalpel? This has led me to open my clinic in Buckinghamshire, UK, where I specialize in everything non-invasive skin, face, scalp, and body. And I love enjoying regenerative treatments combined with energy devices and injectables to get beautiful results. So I want to go back to 2013. This is one of my patients. She's 49 years old, lost a lot of volume, and as you can see, she's deflated. And it took me up to about 13 syringes of facial filler back then in 2013 to get these results. Fast forward 5 years, again, another patient, accelerated aging, and it took 8 syringes of filler to get her to the middle picture and a further 5, all at the same session to get her to this point. It was at that point that I thought, I love the result, but how am I going to continue this into not just her future, but mine, but more importantly, hers? Are we going to keep using this volume of filler? How long are we going to use it for during her lifespan? Is it going to be sustainable for her? But most importantly, is it going to be safe for her as she goes into her 60s, 70s, and 80s? And I couldn't help but think about all of the layers of aging, the 5 layers from skin to subcutaneous fat, superficial to muscle to deep fat to bone. And I thought something was missing. It looked and it felt, and it certainly was, as if everything was detaching from the bone. And as you can see with Professor Kodafana's anatomy explanations, you can see the subcutaneous fat all attached by connective tissue. And it made me wonder, am I missing a trick as we approach longevity medicine practice today? So I go then forwards to 2017 when one of my mentors, Dr. Maurizio De Maio, and he said at Monaco one day, before trying to desperately make our patients look younger, we should first try to stop them from decaying, which really led me to think about how we should really be practicing dynamic and predictive aging. So now fast forward my time here at my practice, 2022 to now, really introducing EMFACE into my practice. And the answer is why? Is because I needed it. I needed it to bring this attachment back. And we know that muscle is the organ of longevity. If we can take that muscle and really pull it up, it is connected to the skin and it's connected to the skeletal template to really reposition and reattach, in my opinion, where everything should be. So I have all 4 applicators now, and these are the kind of results that I got in 2022. We got these kind of beautiful, safe, natural, pinned back results with our patients, and they not only look good, but they also felt great. What I love about EMFACE Eyes, in just 20 minutes, 4 treatment sessions with no downtime. We're really looking at tightening up the lower portion of the orbicularis oculi, which is responsible for herniation of the fat pad as we get older. We know that's going to happen. We call that predictable aging. So why not use an applicator like this to tighten up a muscle that's eventually going to change and really help to lift and reposition and make our patients look and feel better, from their eye bags, dark circles, fine lines and wrinkles, and then finally also for lymphatic drainage. So thank you very much to BTL for your continued innovations. My patients are loving their results, and I hope yours will too.